We're really glad to have everyone joining this Reverse Rett Bite-sized session on puberty and Rett syndrome. Most of you know how these sessions work. Hello, good to see you. So the way that they usually work is we have like a presentation, or in this case, we have our parent panel who will talk for a while. And then afterwards, we'll have some questions. If you want to ask questions as we go along, please do feel free. Just put your hand up, either your virtual hand or your real hand, or you can write the questions in the chat box and ask them afterwards, or one of us can ask them for you. But we would encourage you to be interactive. So it's better if you can ask questions from yourself. One thing that's quite different about these bite-sized sessions compared to other sessions that are put out by patient groups is that we are asking people to openly ask questions. A lot of times when people come to presentations or workshops, especially now in the age of Zoom, you're able to ask a question, but only through the moderator. And the idea of these sessions is that we're bringing people to you so that you can ask questions in your own way. So we are going to record the session. So if you're not comfortable with that, do switch your camera off. We will switch the recording off though when we get to the end, in case there's anything delicate, because obviously this is quite a personal session as it's about puberty. So if people have questions that they want to ask that, you know, might not be protected, the dignity might not be protected during the session, then do feel free to ask those after, and we'll stop the recording at that point. The other thing I would ask is if you do want to ask a question, you can unmute yourself, but otherwise throughout the session, it's helpful if you keep yourself on mute just to take away some of the background noise. We have decided to do this session on puberty because we had a lot of requests that we do a bite-sized session on puberty. And I think it speaks volumes that there aren't that many professionals that want to come and talk about puberty. That's probably because in Rett syndrome, there's not that much that's known about puberty. And there's still a lot of uncharted territory or things we don't fully understand. And that's why we're really grateful for our panel of parents that have volunteered to come and speak today. Because while there are many professionals that will not want to speak about puberty because they might feel that it's not that they don't know some things about puberty or they haven't been through these issues with some of their patients, it's more that I think people don't want to declare themselves as any kind of expert in puberty and Rett syndrome most of the time. But we know with our families that people with lived experience are a different kind of expert and certainly have experience, knowledge, and insight to share. All that in mind, they're still not medical professionals, and anything that's said today is not medical advice. So you should always follow up with your own GP or other consultant. So I'm going to now ask the panel to introduce themselves. We have here today Rita Ross, Zilla Rainback, Melise Davidson, and Joe Snyder. And I'm going to ask you guys to introduce yourself briefly, the name of your daughter, the current age of your daughter, and where you live. And then I will come back to you and ask you the questions about puberty after we've done a round of where you are, who you are, and who your daughter is. So if we start with Rita, and we go Rita, Joe, Melise, Zilla directly, and then I'll pick back up with you afterwards. Okay, thank you. Rita.
Yes, okay. I'm Rita Ross, mum to Francesca, or better known as Frankie now. I live in Tring in Hertfordshire. Frankie will be 17 next week on Tuesday. I can't believe those years have gone so quick. And she probably started puberty around 12, 13 years old.
Hi, I'm Jo Snyder. I live in Switzerland, Lausanne. I'm mum to Clara. She's 19 and she started her period just before her 12th birthday. welcome everyone.
Hi, I'm Louise. I'm mum to Kaelin, who will be 15 in 2 days. We live in Crewe in Cheshire, and she started puberty at 11.
Yeah, hi. My name's Zilla. I'm mum to Hannah, who is 31. We all live in Dorset. Hannah started, I would say, pre-puberty around 10, but she actually started her periods at 12.
Okay, thank you all. And it's great to have you here. And I think it's also helpful that everyone's at slightly different ages as well. So I want to ask you, first of all, at what were kind of the first signs for you that your daughter was starting puberty and how it initially affected her? And we'll go in the same order. So Rita, Jo, Melissa, Zilla.
Okay, yeah, so Frankie, I think the first kind of signs around 12 years old was really her behaviour changed. That she was a really lovely, cheeky, full of personality, a little girl. She could talk when she was little, she could walk, she could use her hands pretty well. And that kind of obviously got progressively worse, but around 12, her behaviour really started to change in terms of her being very moody, very aggressive, yeah, hitting, biting. I don't know how many chains I lost where she'd just rip anything she could get you. So that was kind of that real first sign of something had changed with Frankie, and she wasn't that sweet little girl anymore. She was just kind of emotionally out of control, I'd say. And if you want, like, if you ever said like, no, don't do that, she'd burst into tears with, you know, the big fat rolling tears and that sad face that, you know, would break your heart again. So for me, that was kind of the first signs of something was different.
Did you know what was wrong? Or
at that time, not really, but then I suppose the first signs of something again was going majorly wrong was she'd had seizures when she was little, but then they'd stopped for years, and they were never proper seizures, they were more absences. But she had her first proper big seizure 2 weeks before she started her first period. But we didn't link it, we didn't know that was a thing. But then that continued. So every month, a week before her period, she'd have another seizure. So we started making that link. But her behaviour continually just got worse and worse. You know, bites all over us. At school, she was the same. And also, she lost her vocalisation, but bit by bit. So first of all, she lost her words, and then she lost all her sound. So because before she'd kind of go, yeah, you know, sort of kind of as if she's trying to chat with you. And then she lost that completely. And then her frustration was through the roof. And yeah, we just didn't know what to do, to be honest, at that point, because she would rock in her chair, like you'd have to try and hold her chair so that it didn't fall backwards, because she'd be so strong and so violent with herself and with you. So you're trying to protect yourself and protect her. So yeah, I mean, I remember going to the doctors to try and get something like Valium or something just to calm her down. They wouldn't give her anything because they said that she'd need to go through mental health specialists. And then we went on to a waiting list for that. So yeah, she's just changed like night and day.
that sounds very difficult. So I'm going to move on to Jo at this point, just so that everybody whose child has not yet gone through puberty isn't terrified and disappears from the screen. Jo.
Hi. You know, with Clara, she did have changes. She wasn't using any words by the time she was 11 and a half, but it was the body changes. So she got little boobs, and we're quite a hairy family, so she got more body hair. We're quite a sort of open family, so I thought, oh yes, and I started my periods when I was about 11 and a half too. And she she did get quieter, and she did used to sort of scrunch her face like she was experiencing something in her own body. But unlike Frankie, because she didn't have words then anyway, it was just the usual things. She had feeding surgery for a peg before and everything. But the main thing that happened, like with Frankie Rita, was she did start to have seizures, bigger seizures. Something I hope we get on to talk about later, because there's something yes, it would be interesting to talk about. Anyway, it was the bodily changes first, and she was quieter, and actually, I don't know if it's the right time to mention this, but with the heaviness of the bleeding, and people are like, oh, what you going to do? What you going to do? It's awful, it's terrible. So I put pads in her nappy, but actually didn't need it because she had her nappy anyway. So I tried to sort of simplify everything. And when I was calmer, I think it calmed her down. And then, like with everything, you get used to things, and we just carried on like that. We did go on to hormones later, but I guess that's what we're going to talk later about, that, Rachel. Yeah.
Yeah,
Okay.
we'll come back to that. Okay, thank you. That's really
All
good.
right.
So next, Melise, how was it for you? How did you notice?
Kaelin's pretty much the same as Clara by the sounds of it. For her, it was body changes, like obviously getting boobs and like hair. She never really suffered like pain wise. Yeah, a little bit cramp. You can definitely see cramps. And like Clara, well, she would show like Clara by putting her arm over her face, which she still does. Like if something's not quite right in her world. So yeah, I was early starting as well, so I kind of thought that Kaelin would be, because it does run in our family. But yeah, on the whole, it was actually really nowhere near as bad as I thought it'd be. But she did have an increase in seizure as well. Yeah, like she would have a seizure about a week or maybe even a few days before. So yeah, we did notice an increase in seizure activity because they had been well managed till then, but it was only that few days before our period started, and then generally she was fine.
Okay, that's reassuring to hear as well. And Zilla?
Yeah, hi. So what we saw before Hannah started her period was a change in behaviour, but it was crying spells. Sometimes they were inconsolable, depending where she was. At school, they were sometimes inconsolable, but at home she wasn't too bad. And we just did the reassurance of the favourite TV programme, and then she would calm down. But definitely we saw a change in seizures before she started her periods. And then once she'd started her period, there was a huge change in her seizures. And obviously the body changes, which everybody goes through. So yeah,
So
the main thing is the crying spell. Sorry.
You go ahead.
I said the main thing really, the noticeable difference was the change in behaviour, the crying spells.
Yeah. It sounds like, although Rita's daughter has had a more exaggerated emotional upset, it sounds as if everybody's child has had a similar path to everyone else starting their period, as in it disrupts you emotionally. You get a few bodily changes, and the big difference seems to be this issue around the seizures. So maybe we could talk about that first. I'm wondering if anybody's picked up that their child is just starting puberty.
So Rachel, what's really interesting, we met with Clara's new adult neurologist last week, and she had her EEG, it's every 5 years she'll have one to get the baseline. And I've always, I'm not at all medical, but I've always said right from the word go, there's something about the increase in the estrogen, that something that increases the seizure activity in girls and women with Rett syndrome. So I asked the neurologist about this, and he interestingly said, well, no, we haven't. There's a cohort of 10 women in Lausanne with Rett syndrome, and that hasn't come to his attention. But actually, I was thinking, well, it wouldn't, because he's seeing women, old women, so he won't have followed those women and maybe not even seen their records, or maybe not even noted it when they first started puberty, that this was the case. And it would be very interesting to do a study if people could note it and weren't too sensitive about it. I think if hormones could be controlled, it would really help the girls from an earlier age control their seizures. Just my little 2 cents. I'm not medical. So,
does anyone else want to?
Rachel, can I just say what we did with Hannah? So it was very obvious. So as you know, we've always mapped Hannah's behaviour and seizures, and it was very, very clear that seizure activity happened the week before and just after her period. So because I mapped everything, I could take that to the neurologist and say, this is what's happening. And it was very clear that it was the increase of seizures were the imbalance of the hormones.
Yeah.
So from the age of 17, Hannah's had the Evra patch, which is a form of contraception which balances her hormones. And we carry on mapping, and we've seen a huge decrease. Hannah still has seizures, but they're not clustered around the week before and just after her period. The other thing is, with a contraceptive like the Evra, which is non-invasive, you can control the periods. So she only has a period once every 10 weeks. Which
right, so, yes,
is much nicer for Hannah, much nicer for everybody. She doesn't get the tummy cramps, and then we know exactly when that period is going to be, so we can put things in place if we're going to have an increase of seizures.
And do you find that there's an increase in seizures when you take her off the hormones?
Yes, but when we take the patch off, she's 31, so she's much better, because your hormones will level as you get older anyway.
Yes.
So she is much better. But no, right the way from 17, absolutely, the carers would know, we would know, and we all managed it, and we could explain to Hannah. The best thing that ever happened to Hannah, and I know this is something we're going to talk about at the end, is the Evra patch. And it's non-invasive, it just goes on the back. There are other forms of contraception you might be offered, but for me, everything's got a side effect. Our girls can't, well, Hannah can't tell us she's got a headache, etc. So the Evra patch, if I saw a change in behaviour, you just take it off.
What I'm wondering, and I don't know if any of you have the answer to this, is it that the hormonal disruption in people with Rett syndrome is more significant than it is in the general population? Or is it that the way that they're able to express what they're going through is obviously different, that causes these more extreme reactions? I mean, their seizure threshold is obviously lower.
It's a good question, Rachel. And I think actually one of the answer to that could be, our girls tend to, if they're hurting or in pain, that can sometimes trigger seizures. So I think it's a combination of hormones, and also having to deal with perhaps, headaches, stomach cramps or backache, or, we don't always know. So I think most probably it's a combination of the change in hormones and the discomfort that our girls or young ladies are experiencing. So that would be my gut feeling with personally for Clara, at least.
That's a good point. And also I know sometimes before your period you can become a bit constipated, like the day before, and that obviously is worse for our girls. And so that also, for Amber, that triggers seizures as well.
Yes, that's a good point.
We had a similar experience with Frankie, and also the same around like doctors not believing that there was any correlation between the period and the seizures. But because Frankie she didn't have a seizure for years and years and years, from when she was about 3 years old till then. So I knew there must be something that's similar. And I didn't know whether it was internalizing that pain, what you were saying, Joe, because they can't express it like we can, so you can't go and take a paracetamol or something, or whether that hormone imbalance. But anyway, I kind of argued a lot with her doctor at the time, and in the end because again through parents, actually through some parent forum, I saw that some of the girls were being given the injection where you have it every 3 months, I think it is, and that stops your periods completely. So we did that with Frankie, and immediately we didn't get any more seizures. So she hasn't any seizure activity at all.
I mean, that's very good when you think that. Is she on seizure medication?
No.
That's what's so good, is that you're avoiding a lot of seizure medication.
No, she's on nothing. Yeah, nothing, no seizure medication at all. Literally, that stopped her periods and stopped the seizures. It was incredible. But they then, after about a year and a half or 2 years, they said because the injection was stopping, I don't know if it's estrogen or whichever one it is, but they were worried about osteoporosis, particularly with our girls. So she's now on the mini pill, which is 3 months on, then a week's break, and 3 months on again. So she has a really light period in that time, and again, no seizure activity at all.
And can I ask, Rita, when you took those measures to deal with the seizures, did that also impact the behaviour issues?
Not really.
No. Okay, so maybe we'll come back to the behavioural side of things once we've kind of talked about seizures. I know that it's well, puberty in general is a topic that's come up repeatedly on family forums, and anyone who's been on there will have probably heard, I know Zilla's kind of told us all about mapping everything, and we now map everything for Hannah, and she's spoken about the Everpatch before, but it does seem to be a very common thread of these seizures happening a couple of days before a period. I know Louise has commented in the chat box that it's the same with Georgia, that they see a couple of big seizures a few days before the period starts. So it definitely seems to be a common thing, but there's no research into this. Is that right?
No. Listen, Beth, that's what I was saying, because I've been trying to do a bit of research, and I found a couple of papers, and it's basically where girls pre-puberty, I mean very, very young, 6 and 7 years old, have started their periods, and there have been papers written on that. What is interesting, around that same subject, 4 months ago, we just started hormonal treatment, the pill, lasting for 3 months. And then this week, she's not having it. We're waiting to see, it's the first time, but literally her seizure activity has decreased to almost nothing. It's extraordinary. So there is something, there has to be research done on this.
Yeah.
I think for Kaelin, it is definitely linked to hormones, because once her period settled down, the seizure stopped. They have started every month, well, not every month, sorry, every few months. Again, she'll maybe have one, but other than that, she's settled that way, actually, seizure-wise.
So she's still on the hormones, though?
No, she's never been on any hormone, sorry.
Right.
It seemed that once her body settled down,
Okay.
after starting, it seems that her hormones have leveled out. I know at one point her prolactin levels were actually slightly raised. This was when she was on a drug trial. They found out through the blood tests.
Right.
But the next month, when they'd done the test again, it was fine again. So that was like, I don't know if you know that one. It's like a hormone. It actually, it's like what the hormone that helps you produce milk. like when you're
Right.
lactating. And yeah, so that was picked up when she was on her drug trial. But as I said, the next month it was absolutely fine. So I'm not sure if it was linked to the whole puberty thing. I'd assume so, because it is the same kind of bunch of hormones, isn't it? So yeah, but yeah, once everything sort of seemed to settle down hormone wise, we've had very little in the way of seizures, and she's on no contraceptive, or like she's on seizure meds anyway, yes, but you would still have these breakthrough seizures just before she was due, but they, yeah, for the most part they have actually all settled now. So yeah, for Kaelin it does seem to be a hormone thing, because she does still get tummy cramps that we give paracetamol for. We see when she's a bit uncomfortable, she'll have a bit of wriggle around. But other than that, for her, yeah, she is pretty settled, which I'm glad for.
Well, you know, that's just made me think, having started this session by saying the periods, when you first notice them, they seem to follow the same path as they do for non-disabled young people. There are differences in Rett syndrome, which may not fully be apparent through this panel, because three of the girls that we're talking about, women that we're talking about, are on hormones, which will give you a regular bleed at set intervals. And it's what you were saying, Melise, about Kaelin, which is frequently people will start their period and then their periods will become irregular. And then sometimes they'll just drop off and they won't have them anymore. That was my experience as well with my own daughter, Amber, who's 26 and now doesn't have any periods at all. And she's had her hormone levels checked and they're normal. Excuse me. So she's been checked for polycystic ovaries and she's okay. So we actually don't know why. And I think, you know, earlier I was asking the question of, have people had their hormone levels checked to see if in Rett syndrome, the hormone levels are more exaggerated. And that's what causes these strong reactions, or whether it's just that this is how it manifests in these patients. And I think the answer is we don't know. When I was in Nashville, I bumped into a parent there who used to live in England because her husband is military, American military, and they've now gone back to the States. And she said that her daughter, who's 10, had just been referred to endocrinology because she's starting to look like she might, you know, be moving into puberty. And I thought, that's interesting, because unless people here have an issue, they wouldn't be referred to endocrinology. So for somebody like Amber, it wasn't until she was probably 18 that I started to go, well, why isn't she now having periods? She had the periods and then they were very, very regular, because for about a year, they came at the same time as mine and my other daughters, you know, and then suddenly they kind of just dropped off every few months and it all became very regular, and now nothing. So that's just an interesting piece of insight. And I think what I would say to people who have younger children is maybe not only start keeping the diary before they even start the period, as Zilla has said, just to say, let's see if there's any cyclical nature to the seizure activity.
I think it's really important, because I think, you know, it's quite a nerve-wracking time and people don't want to talk about it. And I think that's a really good idea, sort of before, if you start to notice sort of changes, you know, 11, 12, 13 or whatever. And that kind of gives you that slight feeling of almost control, not control, but in your own life. So it's more structured. So for me, at least, if I understand more, not necessarily have the answers, but understand or have expectations, perhaps, then it's a little bit more calming for yourself. And I think that helps everybody, you know, at the end of the day. So that's a really good point to you said, Rachel, to perhaps, you know, start making a note.
I was also going to say that I think if I could go back, I would ask for an endocrinology appointment before Amber started puberty, so that we could establish what her baseline is, how that compares to normal, and then start to pick these issues up before she starts to go through difficult times. But your comment has made me think of another thing, which is, you know, with everybody else, your other children, when they start to get older, they start asking questions about life and how they're going to turn into a grown-up. I was just wondering, to what degree did each of you explain what was going on to your child, or did you not? Because I think that it's a difficult one, isn't it? So yeah, whoever wants to take that, go ahead.
I must admit, I didn't really go into detail with Kaelin. When she started her periods, we had a kind of, well, yeah, okay, every month you're going to get probably like tummy cramps and things. But her school are very good at explaining it in a way, because our older daughter also went to the same school, and I knew they were very good. So yeah, I kind of copped out, if you like, and kind of left it to them to sort of go into better detail. But yeah, I did kind of explain to Kaelin that our body's starting to change. And actually, interestingly enough, so just thinking about it, Kaelin has actually become more aware of her body herself, because when we're now getting her dressed, she will actually put her arm over herself, like she's covering herself, like sort of protecting her dignity. I thought it was just coincidence, but she does it pretty much every time. So I think it is actually, she is becoming more aware of her body. I would say, but yeah, I kind of left it more to school, to be honest.
Yeah, I have to say I did the same. Although, like, Frankie's had some young carers, so I know they've chatted more. Like Rosie, but they went away for a couple of days, and so they were having showers together and that kind of stuff. So they chat more. But one of the things, I think Frankie might be a bit of an exhibitionist or something, because she loves to look at herself in the mirror. I think she's quite fascinated by her body.
I think you're right.
I did leave it more to the school, and they were very good at doing that kind of stuff around that age for the.
We all have books if we have other kids. And you read that. I read those to Clara and her little brother at the same time as well. And like I said, quite an open family. My older daughter, who's 6 years older than Clara, we always talked openly about periods and changes and sort of those things medical. Not everybody's comfortable doing that. So books are a really good way, picture books, to if you don't want to talk to your daughter, get some really interesting books, eye-catching books, and you may not think they're always listening if they're looking away, but they are, and that's a good way to go through if you don't feel comfortable, talking with your daughter, because not everyone's the same.
I definitely think it's easier if you have another daughter, because my daughter was only a year and a half older, and obviously I'd been going, oh, she's got a period for quite a long time before I got hers, and so she started to know more about what it was. But I have never hidden my period from any of my children, even the boys, and so I'm probably quite open as well, Joe. So even Finley knows what, my son who's 7 knows what a period is, because he's been in the bathroom with me, and he's going, what's happened to you? Okay. So Zilla, do you want to add anything about how you explained to Hannah what was happening, or did you not?
Yeah, we sorry, I was muted again. We're an open family, so we talk freely with her brothers. Yes, she was learning it at school. If obviously Hannah's now 31, and when she was starting puberty, she didn't have an eye gaze, but she's now got an eye gaze. And if she was starting puberty now, there's lots of icons on the eye gaze, and that's what I would be using with her.
That's a really good point. That's an excellent point.
So so probably, Abigail, you might feed into this as well. Things like trying to familiarize them with those kinds of icons before they get to the point where they're frustrated or need to learn.
Yeah, I think, I don't know whether we're different to other families or not, but we've just always spoken to Esme. She turns 12 next week, day before Frankie's birthday. So we've just always talked to her in the same way that I talk to any other person of the same age that she's ever been. So I haven't had to kind of, other than, you know, in the same way as I would for my son, had to sort of really think about, oh, should we sit and model this or talk about it or introduce these new words? We've just always done it. She's really, I put it in the chat, she's really excited about growing up. I'm like, don't get too excited about it. It goes on for a long time. But something that she's always noticeably been excited about is to know the ways in which she's exactly the same as everybody else. And so when I told her, probably 2 or 3 years ago, we probably had a more in-depth conversation about growing up and what happens and changes in your body and that kind of thing. And I said, every single girl in the whole wide world will go through this. And she was just elated. I was like, you are no different to anybody else in that respect, because we do focus so much on the differences. She's very aware of it. She knows she sits in a different chair at the table to everybody else, that kind of thing. So she really likes to know the ways in which she's the same. So she's just really cool about it all and excited. Whether that's good or not, I don't know. But certainly, you know, if you do have a device, you can, you know, access the pages in your language system that focus on that. And certainly, you know, it's funny because I remember my mum, when I was similar sort of age to Esme now, sort of every single thing from probably about the age of 10 was, oh, you know what it could be around the corner, don't you? And I was like, God, Mum, I've just stubbed my toe, you know, can we not attribute everything to that, please? Sometimes I'm just grumpy. Also, you provided me with 3 brothers, so of course I'm grumpy. But, you know, just kind of balancing that out to say, well, you know, are you feeling a bit rubbish at the moment? Yes, sometimes it's okay to just feel crummy or upset for no real reason. We all do that, and that's okay. And just introducing it that way, perhaps, rather than going, oh, you've got a headache, you've got a tummy ache, could be this, because we know it could be a million other things as well, or both, or combination, or who knows what. So yeah, I would certainly start doing that. And if you don't use a device, or you have somebody like I do around the house who's extremely mobile, and so I don't run around with a device trying to get it in the right place all day long, you know, using books, using, you can print out lots of the screens that are available on the language softwares. You can download them for free and print them out. So that could be worth it as well. Have one in the bathroom. So perhaps, you know, if you are, you know, attending to personal care and it's during the time of the month, something like that, then you can refer to it that way so that it's just there. You can just leave it there, laminate it, leave it there, kind of thing. So it just becomes part of the routine. And yeah, I struggled to find a book about growing up that didn't then go on to talk about having babies, because at that point she was what, 9 or 10 or something, and I just thought, I'm just not ready for that conversation yet, because yeah, you know, kind of biologically you kind of could have babies, but you're not going to be, and they would have Rett syndrome, but then it's not that we don't want you and you have got Rett, you know, just too much of a difficult conversation.
I think I'm glad you named it, because I think that's why a lot of us may have not read those kinds of books to our children.
So I found one. They do a boys one and a girls one, and they're actually aimed at children with autism, and they're quite basic ones. The one I've got is it's called something like Ellie's Growing Up. I'll go and get it in a minute. Or no, What's Happening to Ellie, I think it's called. And it's a very thin, like hardback book. Got it on Amazon, and it's very to the point. It says, one day Ellie's in the shower, she notices she has a hair, she pulls it and it hurts. And then it goes through it like this, but it stops at the point at which Ellie is like probably, I'm guessing, about 18 or something, and she's having periods, and she's her body's developed in all the ways that it's going to, and it stops there. So I have that book, which I'll go and get it in a minute. And then I also bought another book that is a bit more kind of, yeah, probably 12 to 14, 11 to 14, maybe it's aimed at. It's a bit more all about me, and it's a bit more general. So it talks about things like body odor and spots and mood swings and stuff like that as well. And I think it goes through all the different things alphabetically or something. I don't know. It's a bit more cartoony. It's, yeah, I think they do an older one as well. But yeah, we use that as well to talk about the less specific things, perhaps more intangible things, the things you can't really give a proper explanation for a lot of the time.
Yeah, and I think it would be helpful at this point, just to be clear, because there are people whose children don't formally use a communication device, and my daughter is one of them, even though she's one. And just to say that there's something really important about being able to affirm with the person who's undergoing, even whatever they're undergoing, that you know what they're experiencing, and that they, you know, I think doing that with icons can be really helpful, even if you're not going into it with the expectation that they are going to be able to communicate to you by pointing, eye pointing, or using a device. Just being able to talk them through, okay, yes, we are acknowledging you might have a, you know, tummy ache, or just feeling down. That, do you agree, Abigail, that that's...
I do. I mean, like I say, we use the device barely at home. We have it when we do literacy lessons, we use it. The rest of the time we don't use it because she's all over the place. She's up, down, everywhere. And it would be impossible. And then it's kind of forced communication. You must come to sit at the table and talk. So she has a really good yes and no. And so I guess probably just through habit now, we're so used to phrasing everything that we say and ask her in that way, because we've been doing it for a long time now, you know, to the point where my son, when he was smaller, would ask, you know, oh, the dog's looked at me. She said, yes.
Yeah.
If you think so. So everybody partner assisted scans in our house, whether they mean to or not. But it's just very much our way of doing things these days. But yeah, I think I think that goes a really long way, just that explanation, because I think, you know, it's frightening, isn't it? I mean, it's like, all this stuff's happening. My mood's all over the place. I'm seeing it with my son now. He's 9.5. And one day he's, you know, happy as Larry. And then the next minute he's just in floods. And I'm like, what happened there?
I'd like to pick up on something else that you said as well, because there are a lot of difficult things about periods and puberty. But for me, and I didn't expect this, but when my daughter got her period when she was about 13, which is the same age as I was, I actually had a moment of pure joy and elation, because I just felt like finally something physically is just happening in the right time that everybody else's daughter's experiencing. And I had just read, this sounds a bit crazy, but I just read The Red Tent, which is a book all about women and birth and through generations and so on. And I was a bit like, I want to take her outside and let her bleed into Mother Earth, because, you know, she's experienced, it's like a rite of passage to start your period. So as much as we're going, wow, you know, there's all these other things going on where you need to make sure you're keeping an eye on seizures, and yes, the behavior might be really difficult. There was also that as well. And I know, Abigail, it was you that made me think of that. We basically had a little party to say, Amber's got a period, when it finally came, because it just felt like a reason to celebrate that she'd got to an age. And when Amber was diagnosed with Rett syndrome, the reality was a lot of girls died in their teens, and she wasn't really expected to live beyond her 20s, is what we were told. So to me, it was this is it. She's getting older, and she's made it to this age, and let's have a celebration. Of course, it brings up problems as well. But it was, Abigail, was when you said Esme was a bit like, wow, you know, something's happening to me. That's
you know, also, Rachel, like celebrating one thing that, you know, you might not think about, but it's really great. Shaving legs, and in the bath. You know, she wears bikinis, Clara, in the summer, and every Sunday we sort of have like our spa day, so that's part of it. So that's a really sort of fun bit. You know, you can be with your daughter. We do face packs, and I shave her legs, I shave her bikini line, and do face packs. And, you know, she's on her chair in her bath, and she loves it. You know, and it's that sort of you know, almost like a young lady, and that all comes with puberty. Yes, she gets more spots, but okay, let's try a new face pack, and she'll lie there. So that's kind of, it sounds weird, but it's kind of like, you know, you sort of bond more as a mother and daughter. when they hit puberty and start going through all those things, and you can find jobs. Oh, it might be hard work to shave legs, and they get a spasm or whatever. You get safety rays and you use nice products and all sorts of things, but it's that you can make it really fun. And
you can add, to say, okay, there's these cool bits of grooming that you have to do, and isn't it great because we're both but you can also say it brings another load of care in that you already struggling to do the essential things. And then, I mean, one problem that we have with Amber as well is she got a little bit of and that's a difficult one, because I like to give her as much autonomy as possible. And so like as she was growing up, I would be like, so that we get her no established, I'm not, if she says to me, because she hates brushing her teeth, if she says a firm no with her head like this, that's a no now even, I'm gonna take that and I'm not gonna brush her teeth. And then I'm gonna go back and say, please let me brush your teeth, and then get her to a point where she's willing to let me brush her teeth. So she's now got a firm no for putting that cream on the face, because she doesn't want, because it stings basically. So I put it on for 5 minutes and then I hold her hands. And she's like trying to get, any way of getting it off. And so then the other day I said to her, how about we use a wax instead, which I'd done for somebody else, and and she was like, but everybody else I mentioned it to said that's cruel. And I thought, I don't think it is, because I think she'd prefer it to be over real quick, So
I think you're right.
This leads to a question that's been asked in the chat, which is about whether or not people with Rett syndrome have a higher instance of PCOS, polycystic ovary syndrome. And I think that I've read that they do, which is why I had Amber checked. I think that it might be that they do, because so many are on anti-epileptic medication, which can cause PCOS, in particular sodium valproate or Epilim, so which Amber is on as well, has been for a long time. So it's something worth checking, I would say. But
and also another thing to mention as well is that if you're taking anti-epilepsy medications, they actually do, certainly for certain sorts, it actually decreases the efficacy of any kind of hormone treatment a lot. And we strangely weren't told this. When Clara first went on hormones, she was still having quite a bit of breakthrough bleeding, and I thought it was a bit strange after a year. And then it was only after sort of year and a half, the neurologist said, oh, well, yes, actually, carbamazepam actually decreases the efficacy or the potency of certain hormones, the contraceptive pills and things like that. And so just as a little aside, if you are talking to your doctor, or if you're lucky enough to go to an endocrinologist, brilliant idea, Rachel, mention, sometimes they just don't think of these things, but say, what are the interaction between the other medications that your daughter may be taking or thinking of taking, because that can actually change the way medicines work, the interaction. And also the other thing to note is that we probably all know is that most epilepsy medicines really decrease the amount of vitamin D you have in your body, and we're all pretty low in vitamin D north of Spain, aren't we? And I think we have to remember that vitamin D is like a hormone, and it's a happy hormone, and if we don't have it, so that could be another reason the girls start to get a bit low if they don't have that.
I think that's a really helpful point to make, is just to make sure that there's a full rounded approach to looking at how to deal with puberty, because obviously there's the hormonal things, and that for a lot of people that's the only thing that will be helpful. But for some people it could be that you just adjust some other things, for example vitamin D. I was interested to see as well in the chat that Shona has mentioned acupuncture, and I have to say, when I was in Nashville, there was I think it might have been, you know what, I'm not going to say who I think it might have been unless I can definitely figure out who it was, but somebody, one of the doctors that was speaking was talking about acupuncture in Rett syndrome, and I thought, isn't that interesting? Because also in the UK, I don't think you would get anybody through NICE or anything to agree to acupuncture for someone with Rett syndrome well, they wouldn't fund it, certainly. Shona, would you like to say a few words about your experience of acupuncture with your daughter?
Oh, I wasn't doing acupuncture with Emily. It was me that was getting the acupuncture. I don't think I could ever do acupuncture with Emily. No, it wouldn't work.
No, because they don't sit still enough, right? Because I've had it as well. It's got to be, yeah. They'd need a general anaesthetic to have it.
Oh yeah. There's no way Emily would ever tolerate that in a million years. No, so I wouldn't even try that with her.
Perhaps there's other people who, I mean, the other thing is, I remember when I had acupuncture, because I had it for quite a long time for an injury which I had sustained looking after, which I still have, which is where my shoulders are a little bit popped out, and just so I get a lot of neck pain and stuff here. But although they can't necessarily have acupuncture, you can do acupressure on specific points, and you can Google it and find out that, of course, this is not medical advice or anything like that, but from my experience, as somebody that's dealt with long-term chronic pain, you know, you can press with your finger, which Amber would tolerate, even on specific spots that you can find with guidance of sort of maps on.
Absolutely, yes, that would be okay. Emily would probably tolerate that, because Robbie used to be a Tai Chi instructor, so you knew a bit about pressure as well, because it sort of goes in with Tai Chi and everything. So yeah, that would be okay. She tolerates some other sort of alternative things, but they'd have to be, you know, not too invasive or anything like that. Quite gentle things, but only gentle things, really.
I guess the issue is always that if you do try something that's more medical, then you can experience side effects. So I'd be interested to know from the panel, those whose children or young women are on hormonal treatments, if there's been specific side effects that you think are worth pointing out. And overall, do you think the balance has been between side effects and required or needed intervention? Do you think the balance has been right for you?
I think that there are the usual side effects from being on the hormonal pill. I think one thing to note also, like for all of us taking any medication, and especially with our girls, young ladies with Rett syndrome, that actually you do have to watch out for osteoporosis if they're having quite a lot of hormones. But I think that should be sort of followed up by the team of carers, doctors, etc. I think that's really important to.
So can we just clear now? So how do people look out for that besides waiting for a bone to break?
I think you ask specifically. I don't know if there are tests. I don't know if Lauren's on this chat. She might know, but I don't know. That's something. I think it's really, really important, because with the lack of vitamin D and with hormones and with other medications, you know, we've really got to watch out for the future, because they've got great futures ahead of them right now, and quality of life is great. So I think you just have to really be insistent with the doctors. Do blood tests or whatever it is you need to find out. So I don't know how we do it.
DEXA scan.
Yeah, DEXA scan.
But initially, definitely checking the vitamin D levels.
Yes,
is a key thing. So
yes.
And then a DEXA scan, but that sometimes they're more reluctant to.
What is a DEXA scan? What is that?
It measures your bone density. Just a quick thing on that. It's not anything that's like routinely done sort of before menopause, really, in women. But obviously things like hormones are a bit different in people with Rett syndrome, so it'd be something that you'd have to sort of push for and have good reason for, like, not good but you know, make your point in a way that you wouldn't have to otherwise, because otherwise it wouldn't really be routinely done. I don't know if that makes sense.
That makes complete sense, and I'm grateful that you've made that that point. So Lauren is a doctor. Congratulations, Lauren. But also the sister of somebody with Rett syndrome, which is actually Joe's daughter, Clara, just to be clear for everyone.
Yes. So Lauren's, I don't know if I'm on mute. No, Lauren's my older daughter and Clara's her best friend and sister.
Thank you for providing that insight. That's really good. And one other thing I just wanted to touch on as well. I know this came up a little bit before, but this is something that's always been very important in our family, but I didn't realize until we got to a certain point how important it was, is the dignity issue. So somebody was saying that their daughter will cover herself like this when dressing. And I remember when Amber was about 10, going to a conference where this was addressed in a session, and it was things I'd never thought about before. So it was things like, as somebody gets older, it's just a bit nicer for them if, rather than when you get them dressed, rather than stripping them completely down and washing their whole entire body, you do it a bit at a time. And I think when you think of somebody crossing over themselves like that, that's it reminds me of having that session. So then from then on, I started to do, you know, top half completely, then bottom half, or the other way around. And then if she was in the bath, putting like a flannel just over her chest, just for her dignity, but also just feels more respectful. Does anyone have any comments on that? I know it's a little awkward.
Well, we tend to actually wash dress separate as well, not in the shower. Showers generally whole body, but that's interesting actually. I think that's something we will try. But it's like in the morning we will, well, Barry will actually do Kaelin's bottom half while she's still in bed, because it's much easier. And then because Kaelin tends to make a mess with breakfast, that's one of the reasons we don't do her top half at that point. So once she's had breakfast, then we do top half downstairs, and we'll close the blinds in the living room and things. So yeah, it is like a half and half. But yeah, she does seem to be very aware of her boobs and likes to, you know, kind of cover them. It's either that or she's getting cold. But for the short time,
I'm really grateful that you said that, because I think the more we hear each other's experiences of how you actually just manage physically with these kind of, you know, the timing of things and so on, it's really helpful. I know for myself, until I went to that conference, I'd never stopped talking about Amber's bowel movements to other people. I hadn't stopped. And she was still 10, and she was 10. And then I started to realize like how awkward that must feel for her. And so she just kind of even now, if you talk about something she's not happy about, which is generally just Rett syndrome in general, you know, or how she's affected, she'll start going like that. And I guess I just thought she was kind of zoning out, but it's actually she's uncomfortable with it. And I think physically things like, I would just do personal care, which I now call personal care, and then I'd call, you know, changing her anywhere. So, you know, in the living room, out on a picnic, because to me things hadn't changed that much. And then after that, I kind of had this epiphany of, oh, you know what, she is getting older, and it is time to start doing things more privately. So I think when you think about the rite of passage of getting to that point of periods, if that's not something you've started to think about, it's probably a good time to think about it. Obviously, I think people do things their own way, and in different cultures with different backgrounds, it depends on your life and family and the way that you do things, of course, but it's just something to think about. Do we have any comments, Beth, that you'd like to?
Well, there's some great chats going on in the chat, and exchange of experiences, I think, about chiropractors, which I think is really interesting. Abigail and Shona, your experiences. Abigail saying that they did see a chiropractor for Esme, which was very helpful, which is not necessarily related to puberty, but certainly something that people might be interested to hear, that Abigail says that improved her other symptoms, such as digestive issues around
osteopath is another good one. Rachel, thinking about you actually with your injury, because I've had problems with my shoulder in the past, to trapped nerve and things, and while I cursed the osteopath for a couple of days afterwards, he worked wonders and my pain from the trapped nerve was gone. He actually freed that nerve. So it might be something like for you, Rachel, completely off topic.
I don't want to be boring, but I have been to the osteopath a lot. I think the general problem is, I don't know who was at the session we did on self-care for carers, but they did one specific exercise, which is if you have to hold like a band and pull it back like that. My basic issue is I had a lot of osteopathy, but I never did the follow-up exercises. So I probably could just use to do that now, but now I've buggered my wrist up because, excuse my wording, because basically because the shoulder's out, the other joints start to be. So, you know, people, while you're thinking about all these things about your child, also consider your own physical health and wellness. One thing though that we was briefly skirted over before, but which may be a major fear for many people, is that actually physically, how do you manage the fact that someone's losing sort of an egg cup of blood every day, you know, when they already are wearing a pad much of the time? And I don't think we should scooch over that. So Jo, you were saying
yeah, I mean, it was sort of I mean, sorry to be so frank, but we have incredibly heavy periods because actually we have a blood condition called von Willebrand disease, so we bleed more than normal. And I was thinking, oh my gosh, you know, how, not me necessarily, but other carers and people at her school at the time, how are they going to manage, you know, with this? So I got lots of different pads, as I said, to put inside the nappies and things. And it was just too much. And you don't actually need it, because if you're toilet timing, you and your pubescent person, and or you have times that you change them, whatever it is, you just change the pad. I think just try and simplify things. I mean, it's not always going to be pleasant or easy. It's not for us, is it? But yeah. I think just try to make things as simple as possible. But I would never consider using tampons or anything like that, literally. No.
I would like to just add in though, and we'll come back to tampons, but I would like to add in that for me, I thought that would give extra protection to Amber if she was wearing a pad inside her pad. But actually it's the opposite, because it reduces the absorbency of the proper pad. And then if they do a big wee, then that's not absorbed and it'll come out the side a lot of the time. And then you have soreness to deal with. So genuinely, it's better if you just use their normal pad and then if you need to change it more often. But pretty much a lot of the time they're quite absorbent. One thing people could think about is, and the continence services won't like me for saying this, but if their child is somebody that bleeds more heavily, is using a nighttime pad in the day during those times of the month, because increased.
It's perfectly. I mean, you know, and there's always a solution to these things. It's just a question of finding out and reaching out, and having a community like this is just brilliant, because, you know, we can ask each other and not feel too, you know, embarrassed maybe about it. But it's important to talk about the messy side of things.
It's necessary, I think. I mean, if we can share this kind of information, we can help each other not to experience some of the difficult situations. I mean, you know, flooding through a pad can tip somebody over the complete edge of life. Yeah. To be honest. Yeah. The carer. And I have to say, I know when I first started my period, I'm going to be very honest here, but when I first started my period, I lived with my dad and we didn't really talk about things like periods, but my older sister had periods and she had tampons. Now I didn't want to ask anybody. And so I just thought I have to deal with this myself. And I read the instructions and used tampons. And so for me, when my own children had periods, the thought of them having to use pads was pretty horrible. And I did kind of question, I think I asked my hospice lady, who Abigail knows, you know, what, and of course, because of their vulnerability, it would be a really difficult thing to use a tampon with somebody with Rett syndrome, but it's such a helpful thing and a personal choice that women make. And for many people would, it's a cleaner choice than having to wear a pad. So I wondered if anybody had any other insights about that. I don't think I've actually met anybody that's used a tampon with their daughter with Rett syndrome.
Personally, I never use tampons. I mean, I don't know periods anymore because I had a hysterectomy, which, to be honest, was the greatest thing in the world. But anyway, I've never used tampons either with either of the girls. One, because Natalie has also got learning difficulties. And I did have to sort of keep an eye on how often she was changing, because she'd maybe not change as much as she needed to. So the whole toxic shock syndrome was a huge worry for me. Because I just never ever felt comfortable wearing them myself. I don't know if my body inside's slightly different or whatever, but they just never felt comfortable for me. And so yeah, for either of the girls, I personally never ever gave it a thought. I mean, with Kaelin, she does get a bit heavy in the first day or two maybe, but then it sort of tails off a bit, and she's fine with just our normal pads, and like maybe that first couple of days changing a little bit more often, but not a huge amount more.
I suppose aside from the intrusive nature of tampons, that you also probably need to be able to say if they're comfortable, because they have to be far enough in to be comfortable, and if they're not, they're really annoying. So that's another point to make. But I would also like to add in that I don't know if anybody uses the period pants, like can't think of any of the brand names, but I'm just thinking that maybe, because sometimes I like it if I can give Amber as much normalcy as body, that's a good one, thank you, Louise, as possible. And also it just kind of gives that flag up to other carers that this is the time of month. I always have put underwear on Amber over her pad, just because I think it's nicer than just having a pad poking out the top of your pants. So I would always fold the pad down and then put underwear on. And if she still had periods, I think I would put the pad, the normal pad, and then one of these kinds of period pants just to, I wouldn't put it alone. I would put the actual pad on and then put the period pant on, just because it's a flag up, but also if because of the fact of having the period then having urine sometimes, then you do get more leakage at that time of month, I found. So that's another idea. We haven't technically gone to questions, so we haven't turned the recording off yet, but I'm happy to close the session, and then if anyone wants to ask any private questions, we've got pretty graphic, I think.
Rachel,
sorry, Zilla.
Can I just add one thing we haven't discussed at all is growth spurt during puberty and scoliosis. That was quite a big thing for Hannah. And what we did from when she was about 11, we asked the physio at school to monitor her spine. And I think that's a real key for younger girls with Rett. Ask the physio. And then we were referred when we needed to. But by the time Hannah was 16 and she'd gone through her growth spurt, it's the growth spurt that you need to be really careful with.
And I think that's another consideration if you're going on hormonal treatment as well, because one of the obvious side effects of hormonal treatment is weight gain. And that can happen going on at any age, and that can impact the scoliosis as well. So if you're somebody that's teetering on the edge of a difficult scoliosis, you might put up with the periods while you get through that period, depending.
Yeah, sorry, Rachel. We were already under spinal consultant when Kaelin started her periods, and he had said before she started, he had said that when she hits puberty, you will see a big increase in her curve, and he was right. It went from something like 40 degrees, I think, no, 36, sorry, to 75. by the time that she had gone through puberty, which was then it was like, yeah, okay, now we are looking at surgery. Still waiting 3 years later, but you know, so yeah, that the spinal consultant did say that when she hits puberty, you will see probably a big increase in.
But on the other side of that, also, we were told with Clara that you know, once the hormones settle, then there is less of a chance of scoliosis progressing and becoming worse. In fact, when she went from being a teenager to all her adult neurologist and doctors, they said, oh, you know, scoliosis is 25 or something, but you wouldn't expect that to change now, because now she's gone through puberty and things have settled down. Now, I don't know if I mean, I believe them there, but that's what we were told. So that, you know, once everything's settled down, then you have to worry less about scoliosis. So,
and that's absolutely right. That's
Yes.
exactly what happened with Hannah. So she was monitored at the spinal unit in Southampton until she was 17. And now she's not monitored at all. But it's about getting that monitoring early.
We had the same experience, actually, that Frankie, they monitored her and she had that growth spurt and they saw a slight increase, and now they believe that she's through it. So I think we've got one more checkup to go now when she's 17, but we can see that it hasn't changed.
So this happened
We're
with
the same.
my daughter. It happened as well, and she was discharged when she was 18 from orthopedic surgeon. But what's happened to her is in the last few years she has put a lot of weight on, actually, during lockdown, which many people did, and it also coincided with having been on the Seizures trial, where she began to be able to eat more effectively because she wasn't struggling to breathe so much. And the weight gain has worsened her scoliosis. She's 25, 26. So it can happen if you have a shift in your weight, even at a later age, that you have a deterioration. Although the typical path is, as Zilla and Rita was saying, you know, once you've got through puberty, it's not so much of an issue. And I think that's true, but there is still an issue if you gain weight and then.
Rachel, can I just add about the help that we got from the CIPP, the Rett clinic? Just because I know I painted that picture at the beginning that probably frightened everybody. I just want to kind of update what happened after that. So through Reverse Rett, we got a referral to the clinic, and it was the first time we really talked to somebody that completely understood what was happening. So they went back to kind of Frankie's childhood and what she was like as a young girl. And what they realised is actually Frankie had this bit of what they call oppositional defiant disorder. So if you ever told Frankie no when she was little, she would hit you. Not obviously as bad as when she got older, but when she was little. So she had this. So they diagnosed her with that. They diagnosed her with anxiety, which is why she was having this, you know, these panic attacks that she couldn't control herself. And they also diagnosed her with mild depression. So they put her on sertraline for the depression, aripiprazole for anxiety, and propranolol, which is just for her heart because of the medication she's taken. And it just changed Frankie. Like, we've got our old Frankie back. So my fear was that giving her drugs would turn her into a zombie, and she's got such a great personality. I didn't want to do that, but it hasn't. It's just made her happy, content. She still will hear, so she's still got that bit of like, so I know somebody mentioned earlier, if you talk about Rett syndrome in front of her, if you talk about the toilet or bowel movements, she'll still hit you. So she still gets upset if you talk about something she doesn't like. But generally, it's just changed her back to our old Frankie. So we were just so grateful to be able to talk to somebody that absolutely understood what was going on.
I'm so glad you said that, because even though some of the mood swings and anxiety and so on with periods is to be expected. Anytime it's more extreme, it needs to be looked at, because it's not necessarily just part of hormones getting older, but it just depends how it manifests for the individual. And what I would say to anyone who's in a similar situation is just reach out to either ourselves or at Reverse Rett or Rett UK, or another parent, perhaps somebody that is on the session. Rita might be a good one to find out what they did, and then or to try and get assistance from the SIP Rett Centre or somewhere else, because you don't have to suffer on your own or in silence. There's ways of checking whether or not this is something that's par for the course for someone of this age or not. And also, you don't have to struggle with pain and anxiety and depression and things like that, which are more common in people with Rett syndrome.
Yeah.
Actually, I'm sorry, Georgia, no, not Georgia, sorry, Louise asked a question ages ago to me that I've only just realised, asking if Kaelin's periods are regular. For the most part, yes, they are. Like you, Rachel, when I was still getting periods, all three of us were in sync. But when Kaelin had her episode, shall we say, a couple of years ago, when she was in hospital with the seizures and the chest infection, it actually knocked her whole system out, and her periods became so irregular again. Some months she wouldn't have them, other months it was like an extended cycle, and it has only really been, I'd say, the last 6 months that we've actually started getting back on track, and that was like October 2020. So yes, now I can say again, yes, they are regular. But we did have a period that, due to chest infection, seizure, whatever it was, they went very off the wall.
Thank you, Melise. I think that's really useful, because also you mentioned earlier that Kaelin also had behavioural issues. I'm glad that that Rita brought that up to bring us back to the behaviour, because I realised we hadn't touched on that. Was there anything behavioural? Did that just settle on its own, or did you?
Kaelin never really, sorry, I'm not quite sure what I've said. Kaelin never really had behaviour issues.
Sorry, that's my mistake then. I thought you'd said that she was initially, before they settled, that she was a bit up and down and
no, I think seizure wise it was, okay. But like once I felt like once her hormones settled, that's when the seizures sorted themselves out, and she doesn't get them all the time. Sorry, that's probably the way I've explained that. No, it didn't actually. I've got to say, we were really lucky. It hasn't affected her behaviour wise. She just maybe get a bit quiet, and she'd put her arm over her mouth.
Yeah.
Which means that she's in some kind of discomfort, or she'd have like wriggle, and that's how we could tell it was her tummy, because like you know when you're uncomfortable yourself, you're a bit unable to get sort of comfortable. That's what Kaelin would do. Behaviour wise though, no, she thankfully was still happy and content, really.
Yeah, well, I think it's really reassuring that what you said is that really everything settled down on its own. So obviously in some cases some intervention is needed, particularly if there's, as Rita was saying, anxiety and depression, and you don't have to just put up with that and settle for that, and as Rita was saying, the SIP Rett Centre can be really helpful. I know my daughter Hannah has had, we're still trialling different medications. She's not tolerating all of them, but we are trying to cope with that anxiety. But also sometimes it does just settle down on its own. The hormones balance themselves out, which I'm sure will be reassuring to people who haven't hit that point yet. I'm glad we came back to the behaviour, because I think that's something that people are quite scared of, and also that it's very hard again to ascertain what it's related to. So I know, having done all the family forums, and Zilla's talked about tracking everything before, we started to track Hannah's all bowel movements, seizures, anything kind of out of the ordinary, like the COVID vaccine or being unwell, and even actually changes in temperature and humidity. We're wondering if that was affecting things, because she started having these cluster seizures. Our difficulty is that she's not having regular periods. So she started her periods in the first lockdown, and she had 5 and hasn't had any since. They didn't phase out, they just disappeared. So obviously we're asking for a referral to endocrinology and to see about polycystic ovaries. But when we're tracking, we can't match a period, and we can't see a kind of monthly cycle. So sometimes, even if she wasn't having the period, you might expect to see some of those behavior changes or the seizures monthly or at regular intervals. So even if you're not getting the periods, the tracking can help. I think it's not it's not revealing very much to us personally at the moment, but I do think since we started doing that, it's a very useful thing to have it all on a chart. And then, as Zilla said many times, when you go to the professional, the consultant, and you can say, look, there's clearly a pattern here, or there's clearly a correlation between no bowel movement for 3 days and then a massive load of seizures, which in our experience aren't taken that seriously until you can present the evidence in that way.
There's just one other question in the chat as well that we haven't answered yet. No, we're over time. From Davina, her daughter is 11 and hasn't got her period yet. She's mobile and daytime toilet trained. And is there anyone else whose daughter who does use the toilet and has a period that can give us any insight? Anyone?
Yeah, Hannah's toilet timed and uses the toilet regularly, and obviously has periods, and we use a sanitary towel, a pad, she has a pull-up, so she rather than a nappy, so it's more like knickers, and she wears knickers over the top of that, and because she's toilet timed, unless she has an accident, which is rare during the day, we just change the pad as as you would yourself if you were wearing pads. So
yeah, Clara's also toilet timed. We take her to the toilet, so she wears, I don't know what you call them, nappies, pads, whatever, and it does make a difference. I think also easier for people and a little bit more comfortable for her as well. But it makes a difference. So with anyone with a younger girl, it's a really good idea to try utmost to try to go for that toilet timing for so many reasons. That's just a bit of a side there.
Well, we also were toilet timed for a long time, but the problem is then when somebody becomes very immobile, then it's a lot more difficult to do the toilet timing. So that's the only sort of aside I would add there, so that people don't feel as guilty if their children are less mobile that they can't manage to do that.
Yeah, we had that, Rachel. Yeah, because I remember years and years ago when we first moved into this house, so 11 years ago, the continence nurse really wanted us to try toilet time, and even got us proper little chair for her. And yes, when she was like that age, it wasn't as difficult because we could lift her. But Kaelin never reliably went. If she did do something, it was by pure chance. The continence nurse would say, "Oh, sit her there for however long until she does something." She could have been sitting there for an hour if we'd let her, and it's like no. And it's like we just come to the conclusion we were putting way too much pressure on ourselves, because Kaelin's never been mobile. And look, the continence she will give you a sign that she is ready to go to the toilet. Well, I'm sorry, Kaelin never. We'd watch and watch and watch. But in the end, we just said, no, this is too much, both for her and for us. And if we were to still try it now, it'd be even more so, because we need to bring her upstairs every time to the wet room, because our downstairs loo just isn't big enough, for anything, and with no hoist or anything. So I think we made that decision to no.
Sometimes the people that you're talking to assume that you can spend all your day looking, sitting, watching and waiting for a sign, when actually that's not not most of our situation.
But I think talking about toileting is another session besides this
Yes.
one. I think there's a lot of good insight from both ends of that situation, but not today. One thing I would also like to add, somebody has written in the chat, and then we'll close. Oh yeah, Abigail requested a spinal baseline when she was small, then having an x-ray and consultant appointment annually for the spinal health and for hips, ankles, and so on. I think if you haven't had that done by the time you get to the start of puberty, that's also a good time to go, okay, let's look every year from now on at the start of puberty. We've talked a little bit about the SIP Rett Centre. The SIP Rett Centre is open to anyone with Rett syndrome in the UK. You don't have to have a genetic diagnosis, or you could have a genetic diagnosis and no classic diagnosis. If you are in a situation where your daughter hasn't started puberty and you want to keep an eye on some of these things, being monitored by the SIP Rett Centre is a good way to start following what's happening, because you fill out these questionnaires on a monthly or a bit more less regularly basis, and then they can track your child's baseline and start to pick up changes that are happening, which may be due to hormones and puberty and may not be, but either way they can flag that up and start some interventions. And I think it's better to be involved at that stage than it is to wait for there to be a problem and then have to have an emergency referral. Also, because the first thing that they do when you do have an emergency referral is they fill out these questionnaires. So the more information that you can give them ahead of time, the better. If you're interested in that, and say you're not on today, you can always email me, Rachel, RACHAEL @reverserett.org.uk, or you can, if you're watching, say, afterwards on YouTube, you can email as well equally, or messenger us through any of our social media things.
Rachel, can I just sort of interrupt quickly to go back to the DEXA scans? You can request a DEXA scan from 6 years old so that you can get the baseline. Just, thinking about any of the hormone treatments that you may in the future go on, obviously for monitoring for osteoporosis. So yeah, as soon as Kaelin hit 6, we requested, kind of forcefully if you like, that she be referred to metabolic consultant, and they are the ones that also checked her vitamin D levels, and since then she has actually been on vitamin D supplements, but she's not had a DEXA for a few years now because her bone density has been generally okay, but yeah, it is something I'd say kind of insist on, whether your pediatrician or whatever doesn't feel the need, especially if you're on reflux meds as well, because of that can also impact on bone density. But yeah, hormone treatments are probably the bigger one. So yeah, you can request that.
Yeah, Hannah has a DEXA scan once a year now, and that was triggered initially because she had a fracture. So that was the first time, and that was maybe 6 years ago. And that was the first DEXA scan was triggered by that, but we've then insisted on one once a year now that she gets one, and that does seem, the spinal consultant is very supportive of that because of her scoliosis, and she's kind of mid-puberty, so we're not quite at that point that we talked about earlier about her being, past the point of the growth spurt, so they're still monitoring quite closely. And it has deteriorated a little since she hit puberty, but they're keen to do that in collaboration with the spine appointments. They'll do the DEXA scan when we have the spine appointments at the same time.
That's good.
That's a Great Ormond Street for anyone who's, if London is your nearest base, Great Ormond Street seemed to be the place that will do the DEXAs, if your local hospital won't.
Well, I know up this way it's Manchester and Alderhay. Manchester Children's and Alderhay can both do DEXAs.
do think it is what Lauren said, though. Typically, they'll need some reason why you feel it's necessary. So, Melise, did you have any fractures?
But see, I actually found out about DEXA scans from one of the Rett UK weekends way back when Kaelin was first diagnosed. Can't remember who it was that talked about it, but the fact that Kaelin's non-mobile put her at a higher risk anyway, and the fact that she's on omeprazole and has been for years also put her at a higher risk. So yeah, thankfully that was one way our paediatrician was actually quite helpful and did the referral. But yeah, like it is pointing out that because if I remember right, it was said at the weekend that girls with Rett, or well, people with Rett, are more likely to suffer from osteoporosis, especially if they are non-mobile. So yeah, I just put that to Kaelin's paediatrician, and he did actually do the referral. And yeah, so hopefully you get someone that will do the referral. I mean, like not about that, but over the years, there's been times where a paediatrician wouldn't refer for something because they didn't feel the need. I've actually gone to the GP instead, and the GP on the referral. So you know, it sometimes if you don't get that avenue, try another avenue.
Look, Millie, it's a good tip for lots of things.
Parents love each other. Mum says no, ask Dad.
Okay, well, I think that's all been very interesting, and we've covered a lot. Beth, do you have anything else that you want to add, or any more?
No, I think there's a lot of information there, and it's been really useful. The recording will go out to everybody, so you can always watch back and find bits that you might have missed, or try and go back to things you wanted to follow up on. The only other thing I'd say is our next Bitesize is on the 18th of May, and that is with Dr. Banker and Dr. Kaufman talking about the Anavex trial. So if anyone is interested in that, the link to book will be in your follow-up email.
Yeah. Okay.
Thank you very much, everybody. Beth, thanks for your organisation. Rachel, everyone, thanks very much. I have to go now, and we'll take care. Enjoy the rest of the week.
Thank you, and thanks, Jo.
All right.
Thank you, everyone. Bye.
Bye.
Thank you very much, everybody, for being here, and for all the participation. It's been great talking to you all, so hopefully see you next time.
Thanks.
Bye.
Bye. Take care. Bye.